This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
Well, this morning, our Spotlight on Your Health is focused on orthopedics. And today we're joined by orthopedic surgeon Dr. Andrew Lee at the George Washington University Hospital. So welcome to the show.
Thank you. It's a pleasure being here. And, you know, being from Maryland, I think it's really special to come back here and get back to the community.
Well, and you're doing it, you know, like you said, in your hometown. I can relate to that as well. But let's talk about your specialty of orthopedics. What exactly you do?
So I'm specifically a hand and upper extremity surgeon. What that means is I treat musculoskeletal injuries from the fingertip all the way up to the shoulder.
Okay.
So I also see things such as, acute injuries, but also things like nerve issues like carpal tunnel. What that really means is that I'm more or less a carpenter. We do use power tools in the operating room, but instead of wood, we are operating on bones instead.
That's so fascinating. How did you get into orthopedics?
I had a lot of great mentors throughout my medical training, and also a lot of my family members were in medicine. So I just felt as though those two kind of led me down this path.
Yeah, and so now you're treating, lots of patients. For patients that do, come across an orthopedic injury, when should a person, go to the ER or maybe choose a clinic instead? What's the go-to?
That's a tough question, and it does depend on the situation. I would say if you have a very acute or sudden injury with a high mechanism of injury, such as a car accident or maybe a fall off a motorized scooter, or you notice that maybe your arm or your hand's kind of twisted in the wrong way, it's really swollen, you might have an open wound, that probably warrants going to the emergency department. Okay. If you have a certain injury that's been lingering for a while, you can't really recall how it happened, it's more of a nuisance rather than something that's very concerning, probably best to see us in clinic.
Okay, good to know. Now, I know you mentioned you kind of focus on, hands up to the shoulder. What other types of injuries do you see that are common with your patient?
One of the most common things that I treat in my practice are hand and wrist fractures.
Okay.
I'm actually going back to the hospital later today to fix one.
Oh my goodness. Do you think that that's also just because more people are typing and on their phones? Do you think that that might have anything to do with it?
I think so, but at least in the DC area, I think a lot of our business does come from motorized scooters. But those are the main things we most commonly see.
So let's talk a little bit about some of the treatment options for someone, that comes to see you. I know surgery sometimes is an option, but do you have other non-surgery treatment options available? We do.
I think broadly speaking, those follow what we call conservative management. So oftentimes in my practice, I offer just to watch it, especially if it's sort of like a minor injury that's not really interfering with your life. Mm-hmm. We do offer different types of immobilization, so casting or bracing. And then finally, we use steroid injections that are sort of to treat your pain as needed.
Okay, good to know. You were mentioning all of these other treatment options, and I just think, as we're kind of getting into a new age of, science and technology growing, what do you see kind of going forward in the field of orthopedics?
I think orthopedics is certainly interesting in that it's among the more innovative specialties. I'm not biased. But I think the future is now. We're sort of seeing the implementation of robot-assisted surgery. We're also seeing that a gradual implementation of both augmented reality and virtual reality in the operating room. So it's exciting to see what lies ahead.
Fantastic. Well, for folks that are maybe watching right now, what other information do you want to leave them with? And of course, the people that probably are in pain that will need your help.
Sure. I mean, we're always available. You can always contact us if need be, either through the GW Hospital website or the landline.
Well, you've got all of the options there, and it sounds like you guys are doing just really great work at the George Washington University Hospital. So thank you so much for sharing your expertise, and good luck with that surgery later today.
Thank you for having me.